Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Diabetes. Introduction. Diabetes is a disease that affects hundreds of millions of people worldwide. Your healthcare provider may have informed you that you have diabetes. Although there is no known cure for diabetes, several treatment options can help you control the disease. The success of any diabetes treatment plan depends largely on you, the patient. This program will help you develop a better understanding of diabetes and how to control it. What is diabetes? The body is made of millions of cells that need energy to function. The food you eat is turned into sugar, called glucose. Glucose is carried to the cells through the bloodstream. It is one of many substances needed by the cells to make energy. For glucose to enter the cells, two conditions must be present. First, the cells should have enough doors, called receptors. Second, a hormone called insulin is needed to unlock the receptors. Once these two conditions are met, glucose can enter the cell and turn into energy. Without energy, all cells die. Insulin is a hormone that is manufactured in the pancreas. Insulin levels in the blood vary with the amount of glucose present in the blood. Diabetes is a disease that makes it difficult for the cells of the body to get the glucose they need to make energy. Type 1 diabetes happens when the pancreas does not make insulin. Because insulin is needed to unlock the receptors, glucose cannot enter the cells. Glucose stays in the bloodstream, causing blood glucose levels to rise. Type 2 diabetes happens when enough insulin is present in the blood, but there are not enough receptors on the cells to let glucose enter. Insulin cannot be used effectively, a situation called insulin resistance. This also results in high levels of glucose in the blood. Type 2 diabetes is more common than type 1. The exact causes of diabetes are unknown, but it tends to run in families. Diabetes is not contagious. Signs and symptoms of diabetes. Your healthcare provider can diagnose diabetes by checking whether you have a high level of sugar in your blood or urine. The most reliable way of measuring your blood sugar level is by taking it before you eat or drink anything. This is called fasting blood sugar. A normal fasting blood sugar level is between 60 and 99 milligrams per deciliter. Levels between 100 and 125 milligrams per deciliter are considered pre-diabetic. Common signs and symptoms of diabetes include excessive hunger, excessive thirst, frequent urination, weight loss. Other signs and symptoms of diabetes include changes in vision, fatigue, persistent itching of the skin, slow healing cuts or infections.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Treatment options. Diabetes cannot be cured, but it can be controlled by keeping the level of glucose in the blood within its normal range. The treatment and management of diabetes varies from patient to patient. Your healthcare provider and diabetic care team will decide what form of treatment is best for you. The success of your treatment depends largely on you. By learning how to maintain a healthy blood glucose level, you will enjoy a healthier life. Controlling diabetes. You can control diabetes by 1. Learning about the condition. 2. Monitoring your blood glucose level. 3. Eating right. 4. Exercising. 5. Taking prescribed medications. Your dietitian or diabetes educator will explain how to plan your meals. They can also answer any questions you may have. The goals of eating right are 1. Controlling your weight. 2. Keeping the level of blood glucose normal. A healthy diet may include changing what you eat, how much you eat, and how often you eat. You may be surprised by how many healthy and tasty food options you have. Exercise helps people with diabetes in many ways. It helps you lower blood glucose levels, lose weight, maintain a healthy heart and circulatory system, relieve stress, strengthen your muscles. Your healthcare team will discuss your exercise plan with you. Always check with your healthcare team before starting a new exercise program. Blood glucose testing is important to see if your blood glucose is where it should be. If not, you may need a change in your diabetes medication, diet, or exercise plan. Your healthcare provider or diabetic care team will give you specific instructions on how to test your blood glucose level. Your blood glucose level is determined by testing a small drop of blood from one of your fingers. This drop of blood is obtained by sticking your finger with a lancet. Blood glucose is normally checked 1 to 4 times each day, usually before meals. Your diabetes educator will teach you how to test your blood glucose at home and the times of day to do the tests. Most people with diabetes become competent at checking their own blood glucose level. Your diabetes educator will also teach you how to make changes in diabetes medication, diet, or exercise plan to help control your blood glucose. The diabetes educator will also review your blood glucose records and make any necessary changes in your therapy. In cases of very high blood glucose levels that do not respond to changes in diet and exercise, medications may be needed. Your healthcare provider will tell you if you need medications or insulin. Your healthcare provider may prescribe insulin. Most people inject insulin into their bodies using a syringe. Insulin is needed for all patients with type 1 diabetes and for some patients with type 2 diabetes. Checking your blood glucose level at home helps you determine whether your diabetes is controlled at the moment of the test. Another blood test, known as hemoglobin A1C, helps your healthcare provider see how well glucose has been controlled over the previous 3 months. A normal hemoglobin A1C level in people who do not have diabetes is usually 5% or less. People with diabetes should try to maintain their hemoglobin A1C at 6% or less, as long as they don't have symptoms of hypoglycemia. A 6% hemoglobin A1C level is equivalent to an estimated average glucose of 126 milligrams per deciliter. The lower the hemoglobin A1C is, the less the risk of having complications from diabetes. Hyperglycemia, high blood sugar. While trying to control your diabetes, your blood glucose can become too high or too low. These conditions should be taken seriously. Fortunately, following some simple steps can help you regain control of your blood glucose level. When too much sugar is in your blood, this condition is called hyperglycemia. Hyper is Greek and means more. Glycemia is also Greek and means sugar in the blood. Hyperglycemia can be caused by eating too much food, eating sweet foods, or not taking your medication. It can also happen when you are sick. If not treated, hyperglycemia can cause you to go into a coma. Signs of high blood sugar or hyperglycemia include blurry vision, dry mouth, fatigue or drowsiness, frequent urination, thirst, weight loss. When you have high blood glucose, drink water or other sugar-free liquids. Juice and sugary drinks will make your blood sugar even higher. Check your blood glucose and stick to your diet plan. If your blood glucose remains high, Call your healthcare team. Your healthcare team will tell you what blood sugar level is considered high for you. If it is too high, you may need to go to the hospital. Hypoglycemia, low blood sugar. Hypoglycemia occurs when too little glucose is present in your blood. Hypo is Greek and means less. Hypoglycemia usually occurs with patients who take insulin or other medications. Hypoglycemia can be caused by taking too much insulin. That is why it is also known as insulin shock. It can happen if you decrease your food intake, skip a meal, or exercise more than you normally do. Signs of low blood sugar or hypoglycemia include dizziness, hunger, faintness, shaking or nervousness, sweating. Other signs of hypoglycemia include confused thinking, crankiness, impatience, personality change, pounding heart. Other signs of hypoglycemia can include blurred vision, headache, numbness in your lips and tongue, slurred or slowed speech. People with diabetes have different signs when their blood glucose is low. Take note of how you feel when your blood glucose is too low. Some patients do not have any signs when their blood glucose is low. These patients must depend on blood glucose testing to find out if they have hypoglycemia. If not treated, low blood sugar can lead to fainting or seizures. Low blood sugar can happen quickly and can be life-threatening. Fortunately, in most cases, the patient can quickly regain control of their blood glucose level by following simple procedures. If you have low blood glucose, eat or drink something containing fast-acting sugar right away. Examples include any of the following: 3 to 4 glucose tablets, half a cup of fruit juice, half a can of regular soda pop, 10 gumdrops, or 2 teaspoons of sugar or honey. If your symptoms do not disappear in 15 minutes, or if your blood glucose remains less than 80 milligrams per deciliter, take another dose of fast-acting sugar. Repeat every 10 to 15 minutes until your blood glucose is higher than 80. Do not eat too much sugar at once, or your blood sugar will spike. If it is less than 30 minutes until your next meal, eat that meal. If it is more than 30 minutes, eat a snack such as half a sandwich or 3 graham crackers. Eat the meal or snack after you have taken a dose of fast-acting sugar. Do not subtract the snack from your next meal. Do not drive or operate equipment if you feel like your blood glucose is low. You should inform your family members and friends that you have diabetes. Tell them to take you to a hospital right away or call 911 if you lose consciousness or are not making sense. Do not hesitate to call your healthcare provider if your diabetes symptoms do not go away, if they happen often, or if you become unable to check your blood sugar level on your own. Complications of diabetes. When you control the level of glucose in your blood, the signs of diabetes become less frequent. You will feel better and have more energy. If you do not exercise, follow your diet, and perform blood glucose tests, serious complications can arise. Complications of diabetes include damage to the nerves and blood vessels of the body. People with diabetes may lose sensation in their legs and feet because of damaged nerves. Nerve damage is known as diabetic neuropathy. The feet or legs could feel numb or unusually cold. Non-traumatic lower limb amputations can occur in people with uncontrolled diabetes. People with diabetes who have poor sensation in their feet must be careful to avoid shoes that fit poorly, hot water, and other hazards. People with diabetes should not walk barefoot. Check your feet every day for cuts, sores, redness, or swelling. Use a mirror if needed. When visiting the clinic, ask your healthcare provider to check your feet. Sexual dysfunction can occur. In men with diabetes, the most common problem is impotence due to damaged nerves going to the sexual organs. Urologists can help treat impotence with surgical and non-surgical treatments. In women with diabetes, Damaged nerves in the pelvic organs and genitals can lead to impaired sexual arousal and painful intercourse. If this happens, your healthcare provider can recommend a treatment. Because the nerves that go to the heart may be affected, people with diabetes who have a heart attack may not experience chest pain. People with diabetes may feel chest heaviness, arm numbness, or indigestion during a heart attack. Adults with diabetes are 2 to 4 times more likely to die from heart disease than adults without diabetes. The risk of stroke is 2 to 4 times higher among people with diabetes. High blood glucose can cause damage to large and small blood vessels. People with diabetes will have more fat in their blood. Fat in the blood can stick to the walls of blood vessels. This causes hardening of the arteries, or atherosclerosis. Hardening of the arteries can happen in arteries leaving or entering the heart. It can also happen in the legs. Your diet plan is designed to lower the level of fat and cholesterol in your blood. When small blood vessels are narrowed by plaque and fat, there is not enough blood flowing to the organs. This causes the death of cells dependent on receiving the blood. The narrowed blood vessels can also bleed. The thickening of small blood vessels is most noticeable in the kidneys and in the back of the eyes. Diabetes is the leading cause of new cases of blindness among adults. You should visit an eye doctor at least once a year to make sure that the blood vessels of your retinas are not damaged. Your eye doctor can treat any damage to the eye caused by thickening of the small blood vessels. This may even save your vision. Diabetes may prevent the kidneys from removing waste from the blood. In addition, proteins that should stay in the body may leak into the urine. Your healthcare provider can test for small amounts of protein in your urine to check for early signs of kidney diseases. Diabetes is the leading cause of kidney failure. People with diabetic kidney disease often develop high blood pressure. Prompt treatment with blood pressure lowering medicines helps prevent kidney problems from getting worse. If you have diabetic kidney disease, your healthcare provider may also prescribe a special diet that is low in protein and salt. In rare cases, dialysis and even kidney transplants may be needed. Gum disease is more common in people with diabetes. Among young adults, those with diabetes have about twice the risk of gum disease as those without diabetes. If you have diabetes and you smoke, talk to your healthcare provider about finding support to help you quit. Healthcare providers agree that controlling your diabetes will help prevent damage to blood vessels and nerves. Proper control of diabetes involves a combination of diet, medication, exercise, and blood glucose monitoring.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Diabetes is a disease that makes it difficult for the cells of the body to get the glucose they need to make energy. Your healthcare provider can detect diabetes if you have a high level of sugar in your blood or urine. Your diabetic healthcare team will help you create a diabetes control plan tailored to your needs and will tell you what your blood sugar level should be. Hyperglycemia can be caused by being sick, eating too much food, eating sweet foods, or not taking your medication. Hypoglycemia can be caused by taking too much insulin. Nerve damage, atherosclerosis, blindness, and kidney problems are all possible complications of diabetes. Controlling your blood sugar levels can help prevent or delay these complications. Diabetes management consists of 1. Learning about the condition. 2. Monitoring your blood glucose level. 3. Eating right. 4. Exercising. 5. Taking prescribed medications. Thanks to advances in medicine, diabetes can be successfully controlled. The role of the patient is essential in making a diabetes management plan succeed.
Thank you for using Explain.